why the lab always asks for MRN. It's because we have unhealthy amount of obsessions on accurate numbers. Just kidding. That's not the only reason we do that. Today, LabRat Sherry answers your curiosity. If you are a nurse or provider, stay with me. Let me answer the patient's question first. So when you're a patient and calling the lab, chances are you are not calling the analytical bench. Most of the time, you will be connected to our customer service. When the lab policy allows, they will give you an answer after they make sure you are you. Right, you hear me correctly. They need to make sure they are not giving the result to your Facebook friends. Your name and date of birth is publicly accessible. What is not publicly accessible, that is your MRN, your receipt number, your reference number, or any of those kind of unique numbers that only you has the paperwork. And now, for our dear nurse and provider, why your basement bills friends always asking for the MRN? First, you guys always give us a room number for your patient. It's always, when we pick up the phone from you, you always started with, my patient Jen Doe in room 3 has blah, 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 and I need to know blah, 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 blah. We do not have that search function. There are so many room 3s in this hospital, and Epic does not give us that search bar saying room 3. Okay, we cannot search for that. There's no such a function in our portal. It does not matter if we're using Epic or SunQuest or any other whatever hospital systems. We don't have that function. So that is invalid information, as simple as that. And now, why not the name and date of birth? I mean, technically, yes. We have that search function of putting name and date of birth and find a patient for you. But listen, my friends, look, I don't know about your end, but in our end, there are so many patients with the same or similar names and having the same date of birth. The second they visit the health network, their information is on our lab portal. Every single one of them forever. Do you know how many different ways we can find somebody spelling Mary or John in our system? Even when putting the date of birth, there are like tens, if not hundreds of them, having either the same name or similar names and with same or similar date of birth. And why do you want to risk that, right? We don't like that. So yes, we can find a patient through that way with a higher risk and a slower speed. And last, the noise. When you guys call the lab, unlike the patient, you are not getting connected to the customer service. You're calling straight into the analytical bench. What does the analytical bench has? We have analyzers. Those machines are very loud. Those monsters yelling into our ears the same time as you speaking. And it makes harder to hear the words you said. So with all these reasons combined, if you can just help us spell out the 10-digit number in 3 seconds, we can find your patient in 3 seconds accurately, smoothly, because it saves the time and energy. And I assure you, we would both like this way. You don't like to call us, we don't like to take the call either. All right, that's all for today's LabRat Sherry. Smooth communication education. Have a good day. I'll see you next week.